Hi, good afternoon, everyone. Welcome to our March meeting. So good to have everyone here. I'm so excited about our conversations and presentations today. As always, if you have questions, this is your space and feel free to drop them in the chat or come off mute. I want this to be as beneficial for you as possible. And this is a welcome space. So as you have questions, as you have thoughts, drop them in the chat or come off mute, and we'll be happy to continue the discussion. We'll go ahead and just chat through our agenda. So here in a couple minutes, we're going to talk through how our navigators can be more involved, some details for our June meeting. And then from 12:15 to 12:30, we will have Jennifer Giordano from ECU Health Cancer Care. She is the outreach coordinator. And then we will have Stephanie Taylor from Kinston Community Health Center. And they will be speaking on uninsured or underinsured lung screening, and potentially how to navigate those barriers and how their system and how they've done so in their roles. So we are so excited to hear from them. We will have an opportunity for open discussion and then our closing remarks and next steps. We do want to thank our incredible sponsors for their support in the Screening Saves initiative and of the Navigator Network. That is Amgen, Merck, Lilly, and Johnson & Johnson. For our updates, so I am excited to share that our June meeting will be on June 12th from 10 a.m. to 2 p.m. I know a lot of people have registered. If you have not, this is a totally free opportunity. It will be at the Maton Hotel in Cary, North Carolina. And if you, we do have travel assistance available if that is something that would be beneficial and potentially help you attend. Again, that's on June 12th from 10 a.m. to 2 p.m. You can register by scanning this QR code. And it is totally free. We would love for anyone who's able to attend to be there. We're going to have incredible discussion and presentations. And with that, an opportunity to talk through some common challenges that we might be experiencing in the lung screening space. With that said, when you go to register, there is a link to submit challenges or barriers or different circumstances that you might be experiencing or have experienced in your role. And please submit those. They can be anonymous. And please de-identify any patient data. But we would love for your input to really contribute to those discussions. What that will look like is a bit before lunch, I will have the challenges or cases organized, and it'll be a conversation with your table. And so, really kind of chatting through different things that you've seen in practice and how to navigate barriers or things like that. So, please submit those, please register. I saw a question come across the chat about a group rate. And so we have two options for hotels. The Maton we do have a group rate for, and the other is a home two suites. And I'm working on getting a group rate for that. So please reach out to me if you'd like details for that. I also wanted to bring up, and I'd be happy and really grateful for any insight or ideas on this. But we wanted to propose the idea of having some navigator leadership. And as we've said, we really want this to be as beneficial for you as possible. And I would love if anyone would consider or think about potentially participating as a facilitator or in the organization of the meeting planning, identifying potential presenters or speakers in this space. It would just help have more of your perspective. And so we can chat more about that also at the end if no one has any thoughts at the moment. But I would really love for everyone to think about that and see if that's something that you're interested in. We would be so grateful for your leadership and contributions in that way. I will go ahead and turn it over to Ms. Jennifer Giordano. Um, she is an incredible partner and supporter of ours. She just recently was named our Dr. Jennifer Garst Healthcare Professional of the Year award winner last week at our annual meeting. And she is an incredible champion for lung screening and early detection. So, without further ado, Jennifer, I will go ahead and hand it over to you, and you just let me know as you would like me to advance your slides.
Okay, that sounds great. Thank you, Macy, and to all those on the call. We'll go on ahead and step into the reason I was asked to share today, and that is about our free low-dose CT lung cancer screenings that started in 2021 here at ECU Health Medical Center. A little bit of background, you can advance, Macy, a little bit of background. So the way that we're able to, I'll just kind of get to it because I know that the time is limited. The way that ECU Health Medical Center, or ECU Health, the system, which is made up of 9 hospitals, and the medical center, which you see pictured on this slide, is what I guess is referred to as the flagship of the system. It's centrally located. But the way that we're able to provide free low-dose CT lung cancer screenings for patients in our 29 county service area is at this time is through our community benefit grants program. And I know every hospital, every health system is structured differently, but I would imagine that most of the systems have something like this in place. And so we have the ECU Health Foundation, donor money. That's where the money's at. I'll just say that's where the money is. So we also at the ECU Health Foundation, as you can imagine, there's programs for our children's hospital, programs for cancer support and services, programs for, gosh, I could go on and on, but of course, you know, I'm going to draw a blank, but they, such as, for example, you may have seen on the news that we just had a crazy big donation to the Brody School of Medicine, which is being built now. They're building a new school, and we just had a huge $110 million donation to the Brody School of Medicine. So they do a lot of great work. And one of the many things that our foundation does is they have the Community Benefit Grants Program. Every year, our Community Benefit Grants Program awards grants to local nonprofits that do work and have programming that aligns with our community health needs assessment priorities. I know you all do the health assessment. I know you probably love it just as much as we love it, but we have to do it. And through that, we're able to apply. People are able to apply, groups are able to apply. We can't, as ECU Health, apply to ECU Health for funds. It has to be an outside organization that applies to obtain these grant funds. So each hospital is awarded money from the ECU Health Foundation each year. The regional hospitals get a different amount, and then the medical center gets another amount. That money comes from ECU Health. They put that money into the Community Benefit Grants Program, and then donors also, that comes from donor money as well. So in 2021, we were awarded a grant through a partnership, and that's kind of how we got this grant, because I just said earlier that we can't apply for money from ourselves. So at that point in time, the Brody School of Medicine, which is part of East Carolina University, applied to receive funding to do low-dose CT lung cancer screenings. So they partnered with us, so the actual screenings take place at our hospital. But the Brody School of Medicine is the one that pays for those. They pay when we do our clinic. I submit invoices to the Brody School of Medicine. So that's kind of how we got that go around there. Not sure that would fly right now, because since 2021, ECU Health Medical Center the system, the health system, has now joined with the medical school. So I'm sure we could figure out a way, because we're going to have to figure out a way this year, because we are almost at the end of this grant, which I'll tell you more about soon. Don't switch the slides just yet. So just to tell you a little bit about how it started is in 2021, which is about the time I just stepped into this role. Prior to all the background work was completed, the grant was written, the grant was approved. So when I stepped into the role, it was kind of boots on the ground time and to actually get the clinic going. So the screenings do take place here at the medical center. They are free of charge for patients that meet the qualifications. It provides a low-dose CT and a diagnostic reading, and it also provides $20 gas cards for those that are traveling from a great distance. So the grant was for $44,000, and it was set to pay for 169 low-dose CTs. This price was negotiated by our administrator with ECU Health CT. We paid $200, and I think they are now around $350 out of pocket. So we paid $200 and then a $50 read fee for, we use Eastern Radiology here in our service area. So it's $250 for a scan. That's how much we're paying. So that's all. This is going to come together to make $44,000. We got 75 $20 gas cards. Not everybody needs a gas card. Some folks travel further than others. And then we had money set aside for promotional material. So this is just a map of our 29 county service area and the 9 hospitals that are in our health system. You'll see in yellow is where the medical center, which is where I'm at right now, is located. So some of the hospitals really, they are quite far from us. I'll be honest and tell you that most of our referrals right now come from Beaufort, which is just east of us, Beaufort, Martin. We've gotten some from Green, Craven, but they're more in that central area. Outer Banks Hospital over on the coast, they actually do their own clinic. They have their own clinic, and they're a little bit different than the rest of the hospitals because they're partially owned by I think Centera. So they have a little bit of a different plan, and they have a great relationship with the Lung Cancer Initiative as well. So, and then Beaufort Hospital has held low-dose CT clinics for uninsured in the past, but so it would be my goal moving forward that we would be able to offer these at all the hospitals. But right now we do this clinic once a month. We do it on the 4th Wednesday of each month in the afternoon. It just makes it easier to be able to handle billing when all of our patients are coming on the same day. It is, of course, for uninsured patients. They have to be a resident of Eastern North Carolina, pretty big area there, and their provider has to have completed a screening referral form, which I go over and just ensure that it is correct. And then, of course, the recommended guidelines that we're all aware of: age 50 to 80, 20-pack year history of smoking, current smoker, or has quit within the last 15 years with no signs and symptoms of lung cancer. So if they meet those guidelines, then their provider faxes me a form. So this is our screen and referral form. It's a front and back. The front talks all about the importance of being screened for lung cancer, and then who qualifies, a little helpful graph there for determining pack year history and what is actually involved in this clinic. So when we started this process, I sent out like a mass mailing to all the local FQHCs in our service area and sent packets of these flyers. So they fax them to me. That's my fax number on the bottom right, and my phone number. Once they send them to me completed, then I reach out to the patient and I schedule them for one of our free clinics. I explain to them how long it's going to take, and just how simple it is. I mean, I don't know about your hospitals, but parking is always an issue here. I tell them that it's going to take them longer to park and come in than it will be to get their scan. So that's what that looks like. And next slide is our, as I said, I schedule the patients, talk about what a low-dose CT looks like. You know, when you're on the phone with someone, sometimes you don't remember all the questions. So I mail them a letter reminding them of the date and time of their appointment, a little map showing them exactly where to come in the hospital at. And then this is on the right, this is just some patient-friendly documentation that I pulled off our cranes on Epic, and just to really kind of break it down as to what's involved. And there's another sheet that I think it's on the back of the letter, but it actually shows pictures of the inside of our hospital, sort of landmarks, so they know they're in the right spot. So to date, we have performed 142 of those 169 free low-dose CTs. We're really proud of that, and we feel certain this year we're going to satisfy that number of 169. Our partnership with Screening Saves Lives, that I'm sure you've heard about, has really helped us in this last year get that number up. We started out of, we started out of the gate strong. We were like at 40 one year, then 38, and then in 2024 we really kind of hit a lull. So we reintroduced the clinic. Just like I did when I started in this role, we introduced it because I know there's a lot of turnover in some of the FQHCs, and people come and go. So we reintroduced it, and then our partnership with Macy and Screening Saves Lives, we had some provider luncheons in our service area. So we had a really great year. Last year for this clinic, we did 32 free screenings, which is up from 17 in 2024. So I was really proud of that, and I expect that number to really go even higher. So we're going to have to start thinking about what's next for this program, and how we're going to fund it moving forward. And I feel like that's going to be fine. I'm not too stressed about it. But some wins with this program is we do a free breast clinic also here for uninsured women that live in Pitt County. So we've received several of patients from the low-dose CT clinic and vice versa that didn't realize, oh gosh, I didn't know you did a free breast clinic, or I didn't know you did lung cancer screening. Because as we all know, everybody's very, very familiar with the importance of mammograms at 40, but we're still working on getting folks aware of the importance and the availability of lung cancer screening. So I do receive public health interns from East Carolina University in the spring and in the fall. They have been excellent in helping promote this clinic and other clinics that I do. So if you don't have interns, I highly recommend finding you some good ones. I actually, Macy knows I adore my interns, and I'm very selective on the ones I get. So, and then a great success, as I've already shared, is our Screening Saves Lives partnership pilot. Can't say enough about how helpful that has been in furthering the message of early detection. So, might have another.
Yes, absolutely. And thank you so much for going into such great detail about this program, because it is an incredible resource in Eastern North Carolina. I would love if you could mention, and these are just the two that I'm aware of from October and November, but could you discuss just like kind of the success story of the clinic with the patient and the findings in October and November?
Oh, yes. So, there you have a great handout, and I don't have it readily available, but as far as how many low-dose CTs you have to do to get a positive. So many of you are familiar with, if your cancer center is accredited by the American College of Surgeons, and ours is, we have to do certain things to meet those, to keep that accreditation. And one of those is, standards to address screening and prevention. So last year, really divinely, our focus was lung. So it was really, and it wasn't super, it wasn't planned that we would use lung as our focus last year, which happens to be the same year that we entered into this partnership with Screen and Saves Lives. So we already, to meet our standard 8.3, which is screening, we had to do a lung cancer screening event at each of our 4 network accredited hospitals. So 4 of our hospitals are in a network together now. Roanoke Chowan, not Duplin, Edgecombe, Beaufort, and us here at the medical center. So we all had to do low-dose CT clinics to satisfy that standard. And yes, we all do low-dose CTs happen every day, all day, everywhere, but we had to do special clinics to meet the standard that were promoted and offered. And some, those clinics we did 4, I think, at Edgecombe, maybe 5 at Edgecombe. 5 patients signed up, and then we did 4 at Roanoke Chowan, but we only did 2 at Beaufort. And you're thinking, gosh, that's not good. Well, yeah, it would have been great if we'd had more. Several signed up that didn't come, but we ended up with a positive finding. In fact, my coworker over at Beaufort, which is the closest hospital to the medical center, she was like, when she asked me, she was like, "How many did we do?" And I said, "Well, you only did 2." And she said, "Oh, we were texting," and she was like, frowny face. And I said, "But one was positive. One was very positive." Not that we're happy about that, I tell patients all the time here, as we're not like hoping to find cancer, but if we find it, we want to find it in its earliest stages, when it's most treatable, when the outcomes are better. When it's just a bump in the road, we don't want it to be the end of the road for you. And so I was really encouraged that through that partnership, we were able to find, this young lady, unfortunately, who did test positive, but she's now in treatment. So I need to follow up and just kind of get an update on what's going on with her. But, sometimes you feel like you're not really moving the needle, but you are. And so, yeah, it was a great, like I said, it's not a win, but it's a win when you find it early. So.
hmm Thank you so much for sharing that. And I think it just goes to show how important this program is, and one patient is worthwhile. To be able to identify and provide early detection for one patient is worth it. So thank you
Absolutely.
so much for sharing that. Um, if anyone has questions for Jennifer, if you do not mind saving those until after Stephanie's presentation, that would be wonderful. So, with that, I am proud to introduce Miss Stephanie Taylor. She is the Director of Quality Compliance and Risk Management at Kinston Community Health Center. And Stephanie, if you are ready, I'm happy to hand it over.
All right. Well, thank you. And thank you for having me today to speak about this. Um, so first of all, I just kind of want to talk about how we got started in this. So when we, back in 2022, we were doing yearly collaborations with the American Cancer Society, and the mention came up about, following our lung cancer screening. And to start with, we were like, I don't think so. We don't really have all those data reports built. It would take, putting that all together and everything. So I don't know. We'll think about it. And then there was, some further reach out and communications about it. And then, of course, they connected us with the Lung Cancer Initiative. And so we decided to just kind of step out there and see what we could do with it. So on the next slide, I have just some data to show kind of where we started and where we were last year when we finished up. So when we first started in 2023, and we kind of made this one of our priority focuses, we weren't really tracking it that much. So I reached out, worked with the senior director of informatics. She built some reports for us so that we could really track those orders, those completed screenings, and so once we looked at the data from 2022, the year before, we noticed that we had only done 11 low-dose CTs for our patients, but we had 857 that were potentially eligible. So we knew right away that we had to do some education for our clinical staff and for our providers. and just kind of look at making sure that we were collecting all the data because, if we know you're a smoker, but we don't know your pack year history, we really can't move forward with that until we have that information. So that was kind of the first point for us was getting some education to our staff and then also to our providers. And so from there, we worked with UNC Lenore, and I know I saw Aaron's name in the chat earlier. So we were able to work collaboratively with them for the past few years and do screening events for some of our patients. And so you'll see there where we started 2022, we ended 2025 with 63 completed low dose CTs. So big improvements there that we've made, but also the orders, the number of orders that were done, not just the completed. We went from 28 to 149 last year. And then our repeat screens, I think, is another point to mention. Our patients who are doing their repeat screenings, that also increased. So that's a part of that, providing that education to our patients, making sure they understand like this is an annual thing that, you need to continue with each year. Altogether, the numbers are down there, but we've had 10 RAD3s and 17 RAD4s that have come back through screenings. So really just, making a difference with these patients, tracking them, seeing what's going on with them, and making sure they're getting that care that they need. So this one, again, just kind of showing year over year how we've continued to see the number of screenings that our patients are completing. And so we were definitely excited to see that. Just wanted to kind of break it down and show some of the patients that have been screened, what we're seeing there. So we serve about 8,000 patients. We have approximately 100 to 110 employees here. So we, kind of looked at our screening rates for all of our patients, but definitely we're able to focus in on some of those uninsured patients. Over there on the screen population, you'll see the breakdowns by that, and that's what these next few slides are. So we were able to screen, and this is last year's data. So we were able to screen and look back at these patients and kind of see if we were hitting those vulnerable populations and making sure that we're getting those resources out to them. And this one just kind of shows about insurance. You'll see there was a lot of Medicare patients that we screened last year and Medicaid, but then we also had those uninsured and those private insurers that we were able to reach out to. And that actual number was up, that uninsured, but we still had a screening event that was planned before this. So next slide just kind of breaks it down by gender. So we have had more males that have completed their screening for us last year than our females. And if you look at our total population, we actually have more females than males. So, just some things that we've been trying to track in the background as well with our data. Age. Of course, there we have the most screenings in that 60 to 69 age group. We still have some in the 50 to 59, but it definitely kind of kicks up once you hit 60. Another interesting thing that, even though the data doesn't show it here, that we've come across is having a lot of patients who aren't quite 50 yet, which, we know that's the screening recommendation, that 50 to 8 years, but they have more than a 20 pack year history. So we have a lot of patients in this area who started smoking very young. And so, that's something too that we've been tracking and looking at with our patients. So kind of some of the things that we've done is, first of all, we were able to put on some screening events, like I said, with UNC Lenore. We had funds from the American Cancer Society, and then we also received the REACH Community Grant from the Lung Cancer Initiative, which we were excited about. So we were able to provide screenings at no cost for our patients. We also were able to provide them with gas cards to help with transportation to those screening events. And so we kind of just put out some information to our patients, and we were, really surprised that a lot of our patients, they were excited about it. They were ready to participate in it. So that was a good thing. And then We set these events up with them, and we were able to get those patients in at different dates. And we did 2 events in 2024, 1 event last year, and we still have some patients that were screening. So it's definitely been a benefit to our patient population, and getting those uninsured patients to do those screenings. And then this will be the biggest takeaway, I think, for me is this patient story. And anytime I'm talking about the grants and the funds that have come through, this is always one thing that I'm so excited to share. So this is just a patient story. When we did our first screening in 2024 with UNC Lenore, we had a patient who came in, and we walked him in, did his screening. And when we were walking out, the patient, was talking to me, and he said, I am so thankful for this. He said, not having insurance, I can't afford it. He was like, so this is something I just wouldn't do. He was like, because that's money I could use for something else, and I just really can't afford to do it. So he was just very nice, very friendly. I remembered him. When the screening results came in, he had a abnormal screening. And he had an abnormal. He was RADS 4. And so they recommended, repeat in 3 months. And so I knew he, financially wasn't able to afford the screening initially. So what we did was we just held on to his information until that next screening event. And we did that in November. So we were able to do the repeat screening for him again at no cost. And of course, after that, we sent him out to the specialist, and he has been on the next slide. You'll see that, we reached out to UNC Lenore. They have a financial aid application. They were able to get that to us. We were able to assist him in getting that completed and get him in with pulmonology for treatment and following from there. This is just one of the patients, but his story just, it's one that just stands out to me because we know that this patient, if it weren't for the funds that came through and really focusing in on our lung cancer screening, we would not have caught this for him because he was not symptomatic at the time. There was nothing going on. He just happened to agree to come in because it wasn't going to cost him so much. It's such an important thing that we're doing for our patients and for our community. So I'll just leave that with everyone.
Stephanie, I am so appreciative of you sharing this. The data is incredible, and just absolutely the patient story. And like I mentioned with Jennifer, it's so worthwhile to hear just helping one patient. So thank you so much. And I apologize that I did not mention before you started that you have been an incredible partner to the Lung Cancer Initiative as well. And so has Kinston Community Health Center. So thank you so much. And with that, Jennifer and Stephanie, I will go ahead and open it up for Q&As, audience. And I know I'll kick it off. I saw that there was a question in the chat. I'm not sure if I think this was for Jennifer, but maybe Stephanie, both of you can answer. Denise asked if you have to do a shared decision-making visit for the screening referral, I believe.
So I'll answer on our behalf. So that happens if you look at that screening referral form. When the doctor speaks to the patient and actually fills that referral out, that is their shared decision making. That is noted on that form that they've had shared decision making.
I'll just say for us, a lot of times when we run those reports, we see our patients who haven't completed their screenings. And so we'll reach out to the providers and say, hey, are you okay with me contacting your patients and asking them about doing their screenings and getting those referral orders in for them? And so that's kind of how on our end we track and follow and find a lot of those that need those screenings.
That's awesome. Darcy asked, Jennifer, do you all have funding for folks to come back for an annual follow-up scan? That's a good question.
Yes, we do. And I was glad Stephanie mentioned that. We do follow-ups. It's not just baselines. We see patients from year to year.
That's a great question. Thank you, Darcy. Any other questions? Feel free to come off mute or drop them in the chat.
I'll say that, provider education has been kind of our focus. But we have a lot of patients that, even though it's free, they will no show us. And I think early on in this program, I was being quite generous with the gas cards, almost to kind of entice them to come. And but then I started thinking, well, gosh, I need to not be quite so generous because I only have a certain amount, and just in all transparency. And but yeah, and I know that it's, we don't want to go to the doctor anyway, right? And this population, especially, we're working to remove that stigma that that they're not, that they they don't deserve this, they did it to themselves, kind of stuff. And we work really hard to do that. And I've been, it's been a challenge for me to get folks here. So it takes a lot of talking. It takes somebody to really connect with the patients and reassure the patients. I don't know if anybody else has had to deal with that.
I was going to say, I think that that's a good point, Jennifer. With us as well, initially some of them very excited, especially with those, gas cards and incentives behind that to help with that part. Then I think that, like you mentioned, it was a good opportunity to bring them in with that and then educate them, like,
Yeah,
you're going to continue these screenings every year, and this is the importance of it and why you need to do these. So those gas cards and those benefits like that really helped us to bring those patients in initially to be able to get that education to them.
yeah. It's like people aren't used to getting a phone call from a hospital for something that is free.
Mhm.
And it automatically makes their ears perk up, like, oh,
Mhm.
what's going on here? It sounds too good to be true. So, but it is true. And so just trying to really connect with them and be genuine and about how important this is to do. So it's a great program. I'm very thankful that I'm able to facilitate the program, like you shared, Stephanie, that one patient that was so appreciative and then ended up being the one that, had suspicious findings. That's a great feeling to be able to provide something, because we all know that by the time someone actually starts having symptoms of lung cancer, many times it can be quite advanced. So to be able to provide early detection on, the country's, most deadly cancer is amazing. I mean, it's like a gift. So
This is Darcy Daggy. I apologize that I'm not on camera, but I oversee the free mobile lung screening program through Atrium. And you
yes,
guys are doing great work. This is amazing. Like both these programs, different areas of the state. But I mean, I think we can all commiserate together on the difficulty of the trust, the lack of trust with people
yes,
coming in. Yeah. And that is when you envelop these patients into a program like this where they know from the beginning that they're going to be taken care of. As simple as a low dose CT scan is, I mean, and you guys have that barrier of them coming to the hospital, which is very daunting, like you said, with the parking
yes,
and everything. I mean, and I don't ever want to try to incentivize patients to come see us, but we are lucky that we have grant funding to help with those food cards, gas cards, because it really does. I mean, they are in need of so many different things. And one thing that we do is a pretty robust navigation assessment for resources so that we have the opportunity to feed them into local resource if they need it. And I think that really builds that trust for them to come back for their annual scan.
right.
And I feel you guys are doing a great job, especially making sure that funding stays for their follow-ups, because that's a big area of concern, I think, from like a system standpoint, is not ensuring that if patients lose their coverage, that they're getting plugged in where they need to for their follow-up. It's just like they're kind of lost, you know? And the re-education for the providers constantly is like exhausting. I think
Yeah.
everybody can relate to that. Especially like with Atrium, as big as it is, it's not listed on the with mammography and PAP, and it's still not listed as one of the recurring health maintenance for lung screening. So yeah, but you guys are doing great work. I think that, this like focus on the underserved is like such a need, and we've been doing this now for 10 years in the mobile space, but we obviously can't get out to the Outer Banks, unfortunately. So I love it that you guys are able to you address the need, you figured out how to get the funding, and you're doing it. That's the work that we love and the work that we do every day.
Well, Darcy, I knew that your name was familiar, and I've heard you present before at our meeting a year ago in Chapel Hill. And
Oh yeah.
you do great work. And so thank you for that encouragement.
Darcy, I'm so glad you're here, and I was really hoping that you would share your experience too. And so thank you so much. And I maybe Stephanie, Jennifer, and Darcy, maybe you all can speak to this, but I want to hear your perspectives of kind of the anxiety that your patients might be seeing, and maybe how you help them navigate that. I know that's a barrier.
I have found that shared decision making
Mm-hmm.
sometimes is not as done super well. And I've had patients call, or I've called them, and I can tell that they're scared that their doctor thinks they have lung cancer, and that's why I'm calling. So you just kind of re-educating and letting them know that you're at risk, but if your doctor thought you had lung cancer, you'd be getting a completely different test right now. So really just, do you have any questions? Do you have any questions? Or, just really trying to have a real conversation with them. I don't know, Stephanie, what do you think?
So I was thinking about that. When we call the patients and we, talk to them, I think that gives us a good opportunity to kind of explain it to them. So, we have had those patients that, like you say, they're like, oh, are they concerned something's going on? And it's kind of just explaining it to them that, not necessarily we're just bringing you in because this is an annual screening. We want to find this as soon as possible. Because you have the best outcomes that way. I did have one from one of the screening events that didn't show that shared, over the phone. The reason for that was, I don't want all that radiology and everything, I don't want to expose myself to that. And so, I talked with them and everything. Ultimately, that patient never decided to do the screening, but I think it just, came back to trying my best to educate him on the low potential there of harm from the exposure versus the potential of harm from something that goes long-term untreated, so yeah, you do see that some with the patients.
Well, and it's really funny because people cherry pick which cancer screenings they want to get done. And we assess, and our team is very fortunate that we offer prostate, colorectal, lung, and mammography for free through our team. But a lot of women don't want to get their mammogram, but they'll come for their low dose CT. And honestly, if you're going to choose between a PAP, a mammogram, and a low dose CT, the low dose CT is the easiest. Like it's the less invasive, but it's also the highest risk screening.
Wow.
You're going to find more, and so I think that it's just really interesting on how much you share with people and what their education level can withstand on the amount of knowledge that you provide to them. And so I don't know. And a colonoscopy is very invasive, and fit test is not so much, but a lot of people are like, I'm not playing with my poop, like I'm not going to do that. And so I think that, if they're willing to come in with their low dose CT, we really try to encourage, like, this is a great step in the right direction. Like, you are taking a step towards your health. And if this just so happens to be the only scan that, or the only test that you get done this year, then let's work on next year. Like, it's really hard in this space. And we've been doing it. A lot of us have been doing this for so long that it's a patient by patient situation. But, and then you have those people that we find something and they don't want to get treated. And should we have asked, well, should we have done this? Should we have done that? But all we are doing is loving these people where they need to be loved. And that's our number one focus. So, like you said, no judgment, come in as you are. We'll help you get this test done and we'll take care of you from there. So
I love it.
This is Sarah Gross. I'm from the Cone Health Chest Center, and I love listening to you guys all talk because I think we all have such a common thread in that our goal is to get as many people screened as possible. We have reached barriers within our own health system. We've had the REACH grant, and they really limit how many patients we can give access to that. They have got such stringent restrictions on who we can offer free screening to. And I was listening very carefully to Jennifer because, what you were saying about how other people, you had the medical school get the grant, and then you helped run it, or you helped facilitate the scans. I'm trying to figure out how we can do something like that because, it's horrendous to have grant money sitting in a bank account that you're not able to use because of barriers your own healthcare system sets in regard to the degree of poverty, and a lot of other things. And that's something that we've struggled with. We've had grants in the past. We haven't been able to use all the money because of the restrictions. And I was really wondering if anyone else has had the same problems. And I'm very interested in talking to Jennifer to figure out how we can maybe get a workaround.
Well, this grant, our community benefit grant that we got in 2021, typically community benefit grants are only for a year. But we didn't have it used up. So we're like in year 4 now, or 5. And they've given us extensions, to keep using the funds, just use it until it's over. And I'm hopeful. We also provide free breast screenings, free mammograms. Like I can't talk today or something, but we provide free mammograms, and they are funded from the foundation. It's not a grant. It's just from a pot of money that is tagged cancer support and services. So that is just a long-standing thing that came before I ever got here. I'm hopeful that when this money is done, that we'll be able to let this flow in, just like they'll see this just like they see the mammogram clinic. That's my hope.
We've even had trouble, with donor money. Like we have donor money that they're not letting us use. I mean,
and see, that's what I'm worried about, because we do too. We have donor money that I don't know how much, but we have donor money, and I'm just believing that they're gonna say yes, absolutely. But I'm not there yet, so I don't know.
Okay, so we're not the only one who's having this problem.
Well, it's, we hopefully Big Brother is not listening to me, like somebody from Atrium Health. So, but they changed the benefits through Atrium and Wake Forest Baptist, and so now we have more patients, more teammates that can't afford to get their deductibles higher, and the copay is over 50%, for the scan, and so that's one way you could weasel your way back into the system and say, hey, you're not letting people with this threshold of income come in, and these restrictions are bogus. Like there are so many underinsured individuals that aren't getting their low dose CT scans done, and statistically, I don't know how you could pull those numbers from your lung screening program, but I mean, it's fact, you know. And the thing is about these free programs that offer these, the focus on the underserved, is we're saving the system a ton of money by finding earlier stage cancers in patients that don't have insurance. And so that, if that community benefit is something that we measure every year, as to, we scan, you know, 17 or 1,800 individuals every year for lung cancer, and we're saving the system X amount of money by diagnosing X amount of individuals with cancer, stage 1 or 2. And so that's kind of how we're not bringing in any revenue in our department. But that's so frustrating that you have money sitting there that you can't use. I mean, I think that really it's just a matter of connect a purpose, saying, hey, this individual was found with this, and we need these buckets of money for this. So I'm happy to talk to you more about that, just because I've been through this a million different times in a million different ways over the years. So,
Okay, we'll definitely reach out to you because, we have a patient population here who would truly benefit
yes.
from getting screened, and we've got money. And because the health system has placed these restrictions, they don't qualify for the money. And, it's probably one of the most frustrating things we've ever experienced.
Yeah.
So,
Y'all, and I am so sorry to interrupt the conversation because this is such an important conversation. But for the sake of time, I'm just going to ask us to pause. But what I will ask is if everyone who's willing, drop your email in the chat. And then I would absolutely encourage y'all to continue this conversation and to connect and to meet and talk through these because these are barriers that systems are experiencing all across North Carolina and beyond. So please continue this conversation. And I apologize because this has been such a good discussion and I don't want it to stop. But out of respect for everyone's time, I do just want to give y'all just a few quick reminders. Again, the June meeting is on June 12th from 10 to 2. We will ask y'all to arrive between 9:30 and 9:45. And I am dropping the registration link in the chat right now. And if you are interested in helping facilitate, organize, or plan these Navigator meetings, please reach out to me. I will include that in the follow-up meeting, but please share if you have any ideas. You also are welcome to share those in the follow-up survey that Zoom pops up after the meeting ends. So please share your thoughts. Please share any topics that you'd like to discuss. And I just want to thank you all so much for just this discussion and encouragement that these are barriers that we're not alone in and challenges we're not alone in. And these could be great challenges to discuss as case studies at the June meeting. So thank you all so much. Please don't hesitate to reach out if you have questions or thoughts. And please reach out to each other. Thank you all so much for your thoughts. I'll talk